What is the most probable diagnosis for a 3-day-old boy who is brought to the emergency department by his mother due to rhythmic shaking of his extremities for a minute? The baby was born after an uneventful pregnancy at term via spontaneous vaginal delivery, with OPGAR scores of 8 and 9 at 1 and 5 minutes, respectively. He weighs 3,100 grams at birth, and has a family history of a brother who passed away due to mycobacterial pneumonia at 6 years of age. The baby's vital signs include a temperature of 36.5 degrees Celsius, blood pressure of 70 by 50 mm mercury, respiratory rate of 30 per minute, and heart rate of 110 beats per minute. He has a cleft palate, coarse facial features, and a harsh systolic ejection murmur along the sternal border. Lab results: WBC count 6,200 per millimeter cube. Hemoglobin 15 grams per deciliter. Platelet count 190,000 per millimeter cube. Calcium 6.2 mg per deciliter, 25-hydroxy vitamin D 12 nanograms per milliliter, phosphates 4 mg per deciliter, magnesium 2 mg per deciliter. A Beckwith-Wiedemann syndrome. B. Chronic granulomatous disease. C. DiGeorge's syndrome. D. Multiple endocrine neoplasia type 1. E. Niemann-Pick disease. Pause the video and think about the answer. Based on the clinical presentation and laboratory findings, the most likely diagnosis for the 3-day-old boy is DiGeorge's syndrome. DiGeorge syndrome is a genetic disorder caused by a deletion in chromosome 22q11.2, leading to developmental abnormalities in various organs, including the thymus, parathyroid gland, and heart. The characteristic facial features seen in this patient, including the coarse facies and cleft palate, are also commonly seen in DiGeorge syndrome. Additionally, the harsh systolic ejection murmur along the sternal border is consistent with congenital heart disease, which is a common feature of this syndrome. The patient's family history of a brother who died from mycobacterial pneumonia is also suggestive of an underlying immunodeficiency, which is common in DiGeorge syndrome due to thymic hypoplasia. The patient's laboratory values, including low calcium levels, are also consistent with the hypoparathyroidism commonly seen in DiGeorge syndrome. In contrast, Beckwith-Wiedemann syndrome is a genetic disorder characterized by overgrowth, macroglossia, and abdominal wall defects, which are not seen in this patient. Chronic granulomatous disease is a primary immunodeficiency characterized by recurrent bacterial and fungal infections, which is unlikely given the patient's age and clinical presentation. Multiple endocrine neoplasia type 1 is a genetic disorder characterized by the development of multiple endocrine tumors, which is not seen in this patient. Niemann-Pick disease is a lysosomal storage disorder characterized by the accumulation of sphingomyelin and cholesterol in various organs, leading to organ dysfunction of brain, nerves, liver, spleen, bone marrow and, in severe cases, lung, which is not consistent with this patient's presentation. DiGeorge syndrome can be remembered with the mnemonic catch-22. Cardiac abnormality, commonly interrupted aortic arch, truncus arteriosus, and tetralogy of Fallot. Abnormal facies, thymic aplasia or hypoplasia, cleft palate, hypocalcemia/hypoparathyroidism early in life.